Hi guys, welcome to my channel. I'm an anesthesiologist, and today in this particular video I will be discussing basic information on three types of anesthesia. The reason why I've decided to make this video is because I've noticed that my patients, when I'm talking to them, they're very nervous about anesthesia itself versus the surgery, which is a surprise to me coming from my side, but understandably so, because when you schedule your surgery, you talk to somebody, you already have met that person, you have gotten a little bit more information about the surgery. But when it comes to anesthesia, you meet this person right before the surgery and they're going to tell you, oh, I'm going to put a tube in your mouth. So I rightfully so understand why it's scary. So let's get into it. This is going to be basic information. If you guys want a little bit more about it, put the comments below and we can go more details regarding each one of them. Okay, three types: general, MAC, aka sedation, and regional. Okay, general anesthesia, very common. Most surgeries are done under general anesthesia. When anesthesiologists tell you, hey, this is going to be a general anesthesia for you, what does that mean for you? It means two things. First, that means that you will be in the medically induced coma. Okay? I know I'm not helping here. I'm sorry. You'll be in the medically induced coma in a monitored setting. Okay? Second part is plus or minus. You might need paralysis, you might not need paralysis. Okay. So when you're under general anesthesia, for sure, you will have something to protect your airway, either an ET tube or a LMA. So the reason why you have those is because under general anesthesia, you are not breathing on your own. So I need to put either an ET tube or LMA in your mouth for you to be able to breathe for you. This is a scary step for a patient, but this is a very important step for the surgery itself. Now, why do I need to do this, right? Why do I need to put something in your mouth and then put you on a ventilator? Why do I need to do this? The reason is you are in a medically induced coma. You are not able to protect your airway. Under general anesthesia, you can breathe on your own, but you need support. You need support to be able to breathe adequate enough for your brain and for your heart and for your body to have enough oxygen in you. So if the surgery itself requires you to be paralyzed, then what does that mean, paralyzed, right? Paralyzed basically means that I'll be giving you drugs which is going to make your muscles not move. That also involves the muscles in your diaphragm, right here, the muscle that actually moves your lungs for you to be able to breathe, right? If I paralyze you, you're not going to breathe. Then I have to make sure that I'm breathing, or the ventilator is breathing for you. So that's basically a general anesthesia. If somebody tells you general anesthesia, basically you're going to have either LMA or ET tube in your mouth and you'll be on the ventilator and it'll be breathing for you. Very scary for you. I understand. The reason why people are scared is because you hear about this horrible story of people going in cardiac arrest, strokes, people being on ventilator for the rest of their lives. And those are the stories only that comes up and people get scared. I understand. But the risk under anesthesia is a spectrum. Okay, it's a spectrum from where the people who are young and healthy are very low risk, and people who are very sick, who are already using oxygen at home, all their organs are failing, they are on the other spectrum. Most people lie right in the middle, okay, or somewhere I would say more on this side. So in older time, the risk for anesthesia and people going into stroke and being on ventilator and dying from anesthesia was high. But now with how our ventilators are, how much monitoring we do, the risks are very low. Okay, I would say for most people, if you're going under general anesthesia, most of your risks are involving sore throat. Okay, when you wake up, you're gonna have sore throat. Lasts about 2 to 3 days. And then it gets better on its own. It almost feels like, when you're getting cold and then you start getting the itchiness around your throat, that's how it feels. Another one is nausea. Okay, nausea is very common in females versus the male. You can become very nauseous when you come out of general anesthesia, but there are enough medications out there which can prevent it. So usually anesthesiologists give you a cocktail to prevent it, but sometimes you're still gonna get it, and that's fine. There's still medication which we can still give and prevent it. So for most people, coming out of general anesthesia is more of a nuisance, nuisance of nausea, nuisance of having some sore throat, not so much all those scary things that like stroke and all that stuff. Most people are easily able to get that tube out and they go about their life, either go to their, in the inpatient hospital, they go at their house. Okay, that's what it means to have a general anesthesia. The second type is the MAC or sedation. Okay, MAC or sedation basically means you are very deep asleep. There are 3 types. Okay, so there's mild sedation, and then there's moderate, and then there's deep. Okay, more I get you deeper, more you get close to the general anesthesia part. If in the deep you get any deeper, then I have to protect your airway by putting that ET tube or LMA back. But what MAC, when I tell you, hey, this is going to be under sedation, what does that mean for you? What that means is you're not going to have anything in your mouth. You're not going to have ET tube or LMA, any of that stuff. You'll be breathing on your own, but you'll be in a deeper sleep. A lot of people don't understand it, right? Remember, like when you're sleeping at night and you're on one side of the bed, when you wake up, you're on the other side of the bed. You moved from one side to the other side. You don't remember that, right? So that's what it is. So it's basically, deeper than that, but you're completely asleep, and that's done by IV sedation. So when you come into the hospital, they're gonna give you an IV catheter where I give you medications. I give you the medications, you start going to sleep. And then when you're inside the room, I actually check that how deep you are. Because depending on the surgery itself, I have to make sure that when the surgeon is about to do their part of the surgery, you're not wiggling around or you're not moving, okay? So I have to keep you deep enough, which is my job, okay? That's my job. But it's a difficult job to do, but it's my job. And then I titrate my medication accordingly. And I decide if the mild is enough, moderate is enough, or I need to get you to the deeper, or in rare cases, I might have to go to general if it's impossible to do the surgery without you moving under the MAC or sedation. That's what it means. Okay, so back up. General, you have a tube in your mouth, or you have an LMA in your mouth. MAC, you have nothing in your mouth, you're breathing on your own, and you're deep asleep. Regional, okay, regional is another medication, another type of anesthesia. Regional means I use a numbing medication. So if you're doing a surgery on extremity, on your shoulder, on your arms, on your legs, then I can do regional. I can put a numbing medication around the nerve that supplies the area. It completely numbs the painful receptors to that area, and that part doesn't move. Okay, now surgeon can do the surgery on that particular side because you're not gonna feel it. So I can do it on the extremity, or I can do a spinal or epidural. Spinal epidural most likely is done for lower extremity surgeries. most of the time it's done for lower extremity surgery. So it can be done for some pelvic areas, or hips, but it depends. So that's what it is for. So in regional or spinal, usually it's done under combination with the sedation, because most people get nervous when they hear, the surgeon doing the surgery part, the smell of the surgery itself. It can make them very nervous. So we usually use a little bit of mild sedation, mild to moderate sedation, to make sure that you're comfortable. Okay. So these are three types. So as I said, like during the regional, you are either going to be completely awake, or you're going to have a little bit of mild to moderate sedation, and you'll be breathing on your own. You're not going to have anything in your mouth. Not all surgeries can be done under regional, because there's limitation on how much I can numb you. Okay, I can't numb, I can't numb your scalp. It's very difficult to do, I can't numb inside of your balls. It's difficult. It's difficult to do. So the regional anesthesia is usually for extremities. You have any extremity surgeries, I can do it on that. So that's what it's for. So a little recap: general, you're gonna have something in your mouth, ET tube, LMA. And you'll be on the ventilator. Most of the time the ET tube will come out, or LMA will come out, and you will go to the recovery after that. Under sedation, mild, moderate, deep, you'll be breathing on your own entire time. This is not required any paralysis. You do not have anything in your mouth. Usually done for surgery which are not either too painful, or they do not require paralysis. Regional is done for either extremities, joints, and it's usually done with a sedation, so you're comfortable during the surgery. So these are three types. If you guys have questions more regarding risks of it, and any other questions you guys have, just put it under the comments. As I said, this was very, very basic, very, very basic. So let me know how you guys like it, and thank you.